Good evening, and a very warm welcome to this third program in the patient education series of the MS Center at Thomas Jefferson University. A series that as this one would not be possible without the generous support of sponsors. And here you see the platinum as well as the gold sponsors of the program series. Their support is acknowledged. How does the disease present in individuals? And we have already talked about this to a degree. NMOSD can present as myelitis, as involvement of the spinal cord, or as optic neuritis. I also mentioned that it can present as hiccups that don't go away. Obviously, there is another differential for that. Or it can also present as a condition where the person has somnolence and narcolepsy with involvement of the brain on MRI. This is called the diencephalic syndrome. So there are different presentations that neuromyelitis optica can take. And from that point of view, it's then important to have some diagnostic criteria for individuals when we consider the condition of neuromyelitis optica. The criteria are very specific for individuals with NMO antibody, the anti-aquaporin 4 antibodies, and the criteria for diagnosis are different for individuals that don't have that antibody present when we test for it. If somebody has NMO antibody present, it is sufficient to have one of the cardinal features of the core features present in order to make a clinical diagnosis of neuromyelitis optica spectrum disorder. As I already mentioned, but I want to show it to you in MRI pictures, the clinical core characteristics are optic neuritis, so when somebody loses vision because of inflammation in the optic nerve. And you see here an example. You see the two eyeballs, and right behind the two eyeballs, you see the inflamed in the middle, the inflamed optic nerves on both sides. So optic neuritis is one of these key presentations. We already mentioned myelitis, and here you see an example of an individual. You see the gray structures that run through the picture, and you see the whiteness in the gray structure. This is longitudinally extensive transverse myelitis. It can also occur when an individual has intractable hiccups. As I mentioned, that needs more work, and you see it over here, what I referred to already before, the area postrema syndrome. The brainstem syndrome can occur. You see the lesion very well represented over here. And lastly, but not least, the diencephalic syndrome. That's where the area that does a lot of integration and processing, the thalamus gets affected, important condition. When we look at who gets what, the diencephalic syndrome luckily is the least frequent that we observe. It's very important that in these individuals, the antibody is positive, the anti-aquaporin 4, and we are sure that we ruled out other conditions that could be mistaken. So the anti-aquaporin 4 antibody is important here. Why is this so important? Well, because we want to treat individuals that have aquaporin 4 positive neuromyelitis optica as quickly as we can. Here you see a cross-section of the spinal cord. And while I don't expect you to interpret these images, You see obviously the areas that is loosened on the purple, and you see that this is an area that is significantly affected. Look at the total size of the spinal cord, look at the area of this lesion, and you know intuitively that this has obviously a very significant impact on an individual's functioning. When we have individuals that don't have the NMO antibody, we need to be a little bit more stringent if they don't have the aquaporin 4 antibody. And there, the individuals need to have 2 criteria in order to diagnose them with neuromyelitis optica spectrum disease. You know already the core criteria. It's then also important that at least one of these criteria needs to be really one of the core criteria, not something that looks like it. And there needs to be, the second criteria needs to be in a different part of the central nervous system. And as always, very, very important, we need to make sure that the MRI doesn't suggest another condition, and other conditions need to be ruled out. I gave you an example of individuals that are belonging in this group. These are the patients with MOG disease, separate conditions that, as I discussed, will be separately discussed. Important here is that the MRI is consistent. Again, antibody against aquaporin 4 in these individuals is negative. It's very important to know that in neuromyelitis optica, there are other conditions that need to be ruled out. And it's also important to note, as I already mentioned, that with neuromyelitis optica, that is aquaporin 4 antibody positive, autoimmune diseases are more frequent. Second autoimmune diseases are more frequent and can, in a certain way, contribute to the presentation of the individual. As always, when we do diagnosis of a rare condition like neuromyelitis optica, it's obviously important that we appropriately rule out other conditions. I just mentioned a few over here. So it is important that the practitioner keeps them in mind and rules out appropriate ones of these listed over here. Obviously, not all of them need to be ruled out in every patient, but one needs to keep in mind that they could look like or behave like neuromyelitis optica. And since this is a rare disease, as I mentioned, in Caucasian 1 in 100,000, in African American 10 in 100,000, it's important to have diagnostic clarity when one diagnoses an individual with this condition. As mentioned, in neuromyelitis optica, other autoimmune diseases can be present. These include lupus, these include inflammatory thyroid disease, these include rheumatoid arthritis, and conditions of the intestinal organs. Particularly in children, this is frequent that we find other conditions present, in adults equally. And so it's very important that when we have a patient where we diagnose neuromyelitis optica, that we are also rule out the presence of other autoimmune conditions and keep an open eye that such conditions could form later on. So once a person is on a journey with neuromyelitis optica, one needs to keep in mind that other autoimmune conditions could again present in an individual, and it needs a certain vigilance and it needs a certain awareness of these potential comorbid conditions that could develop.